Dr. Ashok Kumar Sinha is the retired director of AYJNISHD. Under his leadership, AYJNISHD has launched a national program of providing cochlear implant surgery under the scheme of ADIP scheme. 186 hospitals across the country have been empaneled for conducting cochlear implant surgery, and so far 1,897 cochlear implant surgeries have been performed all over India. Dr. A.K. Sinha sir is alumni of ISHA, Mysuru, and he has worked in different setups. He was instrumental in starting BASLP and MASLP programs along with courses in the area of education of hearing impaired at the level of diploma, B.Ed and M.Ed while working as assistant director at AYJNISHD, Kolkata. He has also worked as director at Composite Regional Center for Persons with Disability, Srinagar, and he has been the member secretary of RCI, New Delhi in 2008. He has been an active member of ISHA and served association as honorary secretary and president as well. He has won 3 Best Paper Award in ISHACon in the field of audiology. His work on CRO's hearing aid fetched him National Award for the Welfare of Persons with Disabilities from the then Honorary President Dr. APJ Abdul Kalam on World Disabled Day in the year 2002. He has also been awarded the Best Paper Award in National Convention of Educators of the Deaf Conference held in Kolkata. He has been contributing to the scientific journals publication. He has published more than 150 articles in national and international journals. He was the editor of Communication Disorders Quarterly, USA, and AYJNISHD Journal of Communication Disorders, AYJNISHD Journal of Cochlear Implant, being published from AYJNISHD, Mumbai. He has also contributed and written many articles in books. He is the clinical director for Special Olympics. As part of clinical director, Special Olympics has been actively involved in healthy hearing screening program for athletes. In this connection, he has trained audiologists at Nagano, Japan and Miami, USA. In 2015, Dr. Sinha was awarded with Professor Padma Shri S. Kameshwaran Endowment Oration Award by ISHA and Bharat Award in 2019. He was the chairperson of the subcommittee and member of the core committee for assessment guidelines and procedure for certification of hearing, speech, language disability, which were notified on 5th January 2018 under Rights of Persons with Disability Act 2016. And today here we have him with us to know about this certification. And over to you, sir.
Good morning, Dr. Amulya. Thank you so much for the nice words.
Thank you.
First of all, I thanks ISHA and state branch of Bihar of ISHA for giving me the opportunity to present the certification of hearing, speech and language disability in India.
Thank you, sir.
Dr. Amulya, I must say that now the AYJNISHD National Institute of Speech and Hearing Disability is touching the number of cochlear implant surgery done all over India is around 3,000. So that's a very good number, and we wish that this things go faster. Even though we are right now in the lockdown, but let us keep our spirit high, and I'm sure together when we follow the social distancing, we will overcome this issue also soon. So let us begin with the presentation today. My presentation will have 4 parts. First part will be a brief introduction of Rights of Person with Disability Act 2016, which will be followed by the assessment guidelines, the procedure, and how to do the assessment for hearing disability, speech disabilities, and language disability. At the end of my presentation, you can have some questions. First of all, I must say, Rights of Person with Disability Act 2016 is a milestone in the history of rehabilitation and the welfare of the person with disability. Government of India enacted Rights of Person with Disability Act 2016 to give effect to the principles of United Nations Conventions for Rights of Persons with Disability, which was done in 2006. India was one of the first signatory to UNCRPD concept, which is based on basically 8 principles of equality, accessibility, men and women with disability equal. And I'm sure when we say the women disability equal, there is a significant thing. I'm sure when we see the census data, the prevalence of disability among the male and female is same. But when you see your own clinical data, you will see the more number of male come for services rather than the female. United Nations Convention for Rights for Persons with Disability also is based on the principle of accessibility, barrier-free, to create an inclusive society. All these have been incorporated in Rights of Persons with Disability Act 2016. Previous act, which has only 8 categories of disability, this act has expanded to almost 21 categories of disability across the various disciplines. New categories like neurological conditions, Parkinson's, multiple sclerosis, blood disorders like sickle disease, hemophilia, thalassemia have been added. Acid attack victim is also added into this category, and we feel ashamed that how acid attack victim is the only category which is there exist in India and nowhere else in the country. New categories such as specific learning disabilities have been added. Dwarfism also is a new category of the disability which has been added into the act. And the new category has come in our field also, that is speech and language disability. This was not there in the earlier act. Even for hearing disability, 2 new terms have been added to the category, that is hard of hearing and deaf. The act is a very comprehensive act, has 17 chapters and almost 102 sections. The highlight of this act is that the act is made by the central government, and central government has got now power to add or delete any category of disability without going back to the parliament. However, if there is an addition or deletion of any category, the parliament has to be informed. So under this act, chapter 10, section 56 to 59, which talks about certification of disability, which is today's topic. As per the section 56 of Rights of Person with Disability Act, central government can notify guidelines and assessment for various specified disabilities, that is 21 categories of the disability. Whereas sections 57 empower the state government or union territory to notify the designation, qualification of the certifying authority. Under this act, the procedure for certification is very clearly laid out, that a person has to apply for issue of disability certificate in disability certificate after assessment, and this is also time bound within 1 month. Inform in writing if there is no specified disability or issue a disability certificate. This is very important in this act. Earlier, the disability certificate issued by a particular government, state government, was valid within that state. But here, the validity of the disability certificate is all over India. That is very important, so person can get the benefit all over India. One more good thing has come up, or is likely to be coming up, that disability certificate can also be issued from other parts of country also, where the person is taking the treatment. One more good thing about this act is there is an appellate authority. Like, for example, the disability certificate has been issued and the person is not satisfied with the decision, he may go to appellate authority. Appellate authority will be notified by the state government. However, the central government, the Director General of Health Service, is the ultimate appellate authority for the issue of disability certificate. As per the provision of Section 56 of Rights of Person with Disability Act 2016, Department of Empowerment of Person of Disability, which is the under Ministry of Social Justice and Empowerment, which is the nodal ministry for welfare of person with disability in India, constituted expert committee from various fields to form the basically to form the guidelines or to form the guidelines for assessment of specified disability. The expert committee constituted subcommittee, 8 subcommittee in different disability. One disability which we were there was hearing, speech and language disability. I'm very happy to inform you that I have been the chairperson of subcommittee and member of expert committee of this. And my members of subcommittee were very fantastic one who were able to come up with such a fine recommendation. Thanks to Dr. Goswami from Aish Mysore, Dr. Ajit from Aish Mysore, Dr. Hatangiri from BYL Nair Hospital, Dr. Reddy, Dr. Rakesh Lal, Dr. Preeti, Dr. Santosh Kakkar was the oldest member of this committee. He was also there in this subcommittee when in 2001 the new rules were made. We were able to frame the guidelines, and the guidelines got approved by the expert committee as well as the committee of the Ministry of Social Justice and Empowerment. Finally, it went to Ministry of Health and Family Welfare, which has recommended to government. Based on the recommendation of Ministry of Health and Family Welfare, central government issued the Gazette notification number 61 dated 5th January 2018, giving the detail of the guidelines. So anyone can have the access available on internet and can download this notification, where the assessing the extent of specified disability has been mentioned. This Gazette notification has 2 parts. Section 1 is basically the expert committee members, the list of expert committee members, and Annexure 2 provides the detailed guidelines. Under Annexure 2, Section 3A, this is hearing impairment has been mentioned. Under this guideline, the definition of hearing impairment, the definition for the deaf and definition for hard of hearing has been mentioned. I must tell you that this definition is just same as mentioned in the Rights of Person with Disability Act. Let me first begin and make a special point here that the definition of disability as per the Act is a long-term impairment, that is permanent impairment. So any disability issued will has to be a permanent in nature. Temporary nature are not been given into these issues. Deaf has been defined as the person who has the pure tone average at speech frequency of 70 dB and above, and hard of hearing has been defined as 60 to 70 dB, between 60 to 70 dB. This is important one. And the disability, this PTA has to be in the both ear. So because in the Act it has been defined as a benchmark disability of 40%. So here 60 dB PTA in both ear becomes a benchmark disability. So that is very important point which has been to be taken into consideration. Now we move on to the guidelines for assessment as given in the notification. For hearing disability, the guidelines are basically based on measurement of air conduction threshold. Now here the hearing disability will be only defined based on air conduction threshold. No bone conduction threshold has been taken into consideration. Air conduction threshold has to be done as per the standard pure tone audiometry, which has been there, which has been laid down. And the most important is that pure tone audiometry has to be conducted only by the audiologist. Now this is very clearly mentioned in the guideline or notification, the Gazette notification of India. The pure tone average has to be measured for both ears separately, that is right ear and left ear separately. And it has been mentioned in the guideline very clearly that if air conduction thresholds are not reliable, then additional tests are recommended, such as impedance audiometry, speech audiometry, or electrophysiological like ABR and other audiometry. Now this is very important. Like for example, based on ACT, one can give a disability certificate, absolutely no issue if the thresholds are reliable. If not reliable, then it's not the end of the story, but we can ask for the additional test as is been mentioned in the guidelines. For children also, it has been mentioned in the guideline that children condition play pure tone audiometry can be done, or visual response audiometry can also be done. As I said, as Dr. Amulya also mentioned, that AYJNISD is now nodal center or nodal agency for implementing cochlear implant. And the cochlear implant, the age of the cochlear implant as per the ADIP scheme is 1 year. So for 1 year child also we have to issue a disability certificate, because under the ADIP scheme, if you do not have disability certificate, the concessions or the instruments will not be given. So it is important that even the children must get the disability certificate. And therefore, it has been mentioned in the guidelines that for children also, you should do the condition pure tone audiometry or visual response audiometry. Even for infant and young children, it has been mentioned that go for electrophysiological hearing, that is ABR and test. So based on that, all age population can be given hearing disability certificate. Now, the procedure for computation of percentage of the disability, hearing disability. Here, based on air conduction threshold, pure tone average, but this pure tone average is for 4 frequency, that is for 500 hertz, 1 kilohertz, 2 kilohertz, and 4 kilohertz. Now, the trend has been very much there in the audiology that when we say pure tone average, it's 4 frequency average. Monaural percentage of hearing is calculated based on this. Suppose a person does not give any response at the highest limit or maximum limit of the audiometer, then no response to be considered as threshold of 95 dB. As 95 dB is the upper limit, whereas 25 dB has been lower limit as per the American Medical Association formula. Ready reckoner, for the first time, the ready reckoner has been made, and from that ready reckoner, you can just find the monaural percentage of disability based on PTA. For example, in this ready reckoner is there in the guideline 0 to 25 dB PTA, that is PTA in 4 frequency up to 4 kilohertz, 0 percentage of disability. If PTA is between 0 to 25, percentage of monaural disability becomes 0. If it is 59 dB, then the percentage of disability is only 27%. That is monaural hearing disability. Like that, up to 95, this table has been given. You will see here that at 60 dB, the benchmark disability of 40% matches. So this ready reckoner matches the definition of hearing disability as per the Rights of Person with Disability Act. So this becomes a very correct way of bringing in the disability. Based on that, you have to calculate first the monaural hearing disability. Once we calculate the monaural hearing disability for better ear and the poorer ear, or if it is in this both same ear, no issue. Use a simple formula. This formula has been mentioned there. That is better ear percentage of hearing disability multiplied by 5 plus poorer ear percentage of hearing disability divided by 6. So that will give you the percentage of hearing disability. So very easy, very simple. But remember that first you have to find a monaural hearing disability from the reckoner, and then use this formula where the better ear percentage of hearing disability into 5 plus poorer ear hearing disability, monaural hearing disability, and divide by 6. That will give you the hearing disability. Let us take an example. Let us take an example here that for right ear, air conduction threshold is 55, this one, and 65 at 2000 hertz, and 4000 hertz is 70. So PTA becomes 62.5. Remember this value, 62.5. For left ear, the air conduction threshold of 60, 65, 70 or 70 at different frequency as being shown on this slide, the PTA becomes 66.25. Let us find out the monaural disability as per the PTA. Remember this 62.5 and 66.25. Now 62.5 doesn't stand on the ready reckoner. So if it is 0.5, we can round it up to 63, and that becomes the 45.13 as the monooral hearing disability, and for 66 it is 50.26. And put this on the formula. 45.13 into 5 plus 50.26 divided by 6, and that becomes the 45.98%. So the person has the hearing disability of 45.98, and benchmark disability is 40%, and therefore hearing disability under the category of hard of hearing can be given here. So that is something which we can able to work it out. Take another example. 1 year, right ear is normal hearing, that is PTA of 12.5. 12.5, so hearing is normal in 1 year. Left ear, there is a severe hearing loss, like thresholds at 80, 95, 100, and 4 kilo, no response. When it's no response, then we have to take the threshold as 95, not 100. Even though the upper limit of the audiometer might be 100 or 110, but we have to take threshold only as up to 95 only. So thus PTA becomes here 61.6. PTA here becomes 61.6. Now with this PTA, we can again go back to the ready reckoner. Ready reckoner, the earlier PTA was 12.5, so 12.5 falling into this group. So percentage of monooral disability is 0. And the next one, we'll see what was the percentage, 62. So 62 PTA, the percentage of disability is 43.42. Now put this into the formula. So 0 into 5 plus 43.45 divided by 6, that comes to 7.23. So benchmark disability is 40. Therefore, the person has to be given in writing that your benchmark disability is not 40, it is only 7.23. Therefore, certificate will not be, disability certificate will not be issued. So like that, one can able to work it out. Now this being a mathematical formula, for issuing the disability certificate, a medical board has to be set up by the state government. Generally, the medical board is headed by the medical superintendent of chief medical officer or civil surgeon or any other equivalent authority as the state government has notified, and the member will be ENT specialist. Audiologist is a must there, and state government notification, audiologist is a must there. So in a medical board, there will be ENT specialist, audiologist as the member, and that head of the certificate medical board can be medical superintendent or any authority which is equivalent authority notified by the state government. Some of the state government has already notified, like ISHA National Institute of Speech and Hearing Disability in Mumbai is the medical board, has a medical board which issues the disability certificate for all over Maharashtra. And for Mumbai right now, Mumbai, and appellate authorities from all over Maharashtra. So even the government of Maharashtra has notified appellate authority of to AYJNISD for all over Maharashtra. Kerala government has also made a notification, and I wish that all other governments are also making the notification for such a medical board where audiologist becomes a prime member. Now, this disability certificate has to be issued on a digital platform. So a mathematical formula, one can only has to just punch the air conduction threshold, and the disability is calculated by the computer. So that is also there, and the government of India has also already made a digital based platform which is being used by all the state government for issue of the disability certificate. Hearing disability certificate is very simple now, very simple and easy. Ready reckoner is there. Use that ready reckoner, and there will be no difficulty. Let us move on to the second part. Second part for speech language disability. Now, this second part, as per the notification, it has been mentioned in 3rd B, the regarding speech and language disability. And we had a real challenge here because this is a new disability added, and we would also like that, like an hearing disability, a mathematical formula has to be made. And I'm very happy that our committee could do it and it is being notified, which I'm presenting you today. Again, if you see the definition of speech and language disability, very clearly it has been mentioned in Rights of Person with Disability Act 2016, Schedule 1D, that speech and language disability has to be permanent disability. That is long-term permanent disability, such as languotomy or aphasia, and either component of speech and language must have deficits or in the both one. And the cause of the permanent disability of speech and language disability has to be organic or neurological causes. So functional causes which are not considered for the speech disability at all. That is very clearly because it has been mentioned in the Rights for Person with Disability Act. For speech component, as per the guideline, as per the notification which has been there, the conditions have been identified such as languotomy, glossectomy, bilateral vocal cord paralysis, maxillofacial anomalies, dysarthria or apraxia speech. So these are the conditions which has been there mentioned in the notification for qualifying for the speech disability. Now, how do we compute the speech disability? That is very interesting, and I must ask you to carefully listen about this because we have got a new term here in this disability. For computation of speech disability, two parameters have been taken. One, that is A, speech intelligibility test, and B, voice test. From speech intelligibility test, we will derive a score that will be called as percentage of SIA, that stands for speech intelligibility affected scores. So from speech intelligibility test, we will derive percentage of speech intelligibility affected scores, and from voice test, we will derive another new term, that is percentage of overall voice clarity affected score, or OVCA. OVCA, like SIA, OVCA, and these two parameters put on a mathematical formula will give us a speech disability. That is very important. So I repeat, speech intelligibility test, from there, from that score, we will derive one score, percentage of speech intelligibility affected score, and from the voice test, we will derive percentage of overall voice clarity affected score. And then we will have a mathematical model or formula to compute the speech disability. In the notification, there are two tests which has been mentioned. Either of these two tests be conducted on the person from whom we are going to give a speech disability certificate. Speech intelligibility test as given by AYJNISHD, that is Aliya National Institute of Speech and Hearing Disability, the Perceptual Speech Intelligibility Rating Scale 2003, or Perceptual Rating Scale of SRMC Medical College, that is Sri Ramchandra Medical College, Chennai 2004. Both the tests are almost similar in nature. There is the stimuli used to elicit the speech intelligibility scores can be reading and conversational speech. Not or, but it should be both reading and conversational speech. Scoring for speech intelligibility test is slightly modified, and that we can able to derive the speech intelligibility affected score. Now let us see the test. The test is, this is the test which is there. It has a standard test procedure. The rating is from 0 to 6, but in the into this guideline or this notification, the scoring pattern is from 1 to 7, which is equivalent to 0 equivalent to 1 here, 1 equivalent to 2, and further on. Here we can able to see that normal intelligibility of speech. Suppose we'll say 1 normal intelligible speech, then SIA score is percentage of SIA score is 0 to 15. 0 means a lower range and 15 becomes the upper range. For example, if a person has a normal speech intelligibility, we will rate him as 1 and his SIA score will be 0 to 15%. 0 lower range and 15% is upper range. For example, for 7. Suppose somebody whose speech cannot be understood even by the listener, even the content is known, then we will score his rating as 7, which will be equivalent to 90 to 100. That is 90 to 100% of speech intelligibility affected score, 90 being the lower range and 100 become the upper range. Now this is very simple test, but here I must say that at least have some trial and get your reading perfect. Maybe it's almost like self-calibration that if I hear the speech sample, can I able to make the correct scoring using this scale? So that you can able to try, work it out very well. Now the second test is voice test. Here also, as per the notification, two options have been made. Either one can go for perceptual testing or can go for instrument testing. For perceptual testing, the consensus auditory perceptual evaluation of voice KPV 2000 has been made, which measure the various parameters as roughness, breathiness, strain, pitch, loudness, and overall severity. Stimuli used can be vowels, sentences, and conversational speech. So for perceptual test, just like speech intelligibility, perceptual test is there. This form is available. You can even download from the net. The consensus auditory perceptual evaluation voice test. Here, the testing is based on a line. So this, if you see this line, this line is 100 millimeter line. Now 100 millimeter line is almost like a 4-inch line. Now here, suppose if you have a roughness and if you are marking a roughness, say this is for the mild, this is moderate and severe deviation. If it is fine, normal, then you can mark it at a 0. The overall score becomes 0 out of 100. Suppose if you say that no, almost 50 point or your roughness is more and you want to scale it at around 50, then bring it to somewhere here and score here as 50. So in overall voice quality, roughness, breathiness, strain, pitch, all this parameter you can add. Here the test also provide 2 more parameter which is not included here, and if you feel you can add that also, and then come to a score, all this score, and take an average. Now that is important. Okay, so I think I'm clear about this, that for this you score on a line and this will be a record. That is will be very important record. And here you can see the overall scoring, that is from 100, and get a overall score. Now the overall score of 0 to 100 has been put into a different step of 1 to 7. Here is the different step of 1 to 7. Now suppose when you go with that overall voice clarity effect, suppose voice is normal, that means our score will come between 0 to 15. Now 0 to 15 becomes equivalent to 1, where overall voice clarity affected score becomes 0 to 15%. That is 0 lower range, 15 upper range. That is very important. This lower range and this is the upper 15. Now suppose somebody voice is severely deviant, then score may fall somewhere around say 95. So 95 means the score here will be 7, and 7 is equivalent to 90 to 100. That is 90 lower range and 100% is the upper range. So this overall voice clarity OVCA is also calculated from this. Now we have got 2 measures. One, speech intelligibility affected score SIA, and second measure is OVCA, that is overall voice clarity affected score. So 2 measures have been with us. Now we will compute the speech disability. Sorry. Before that, I may say we have an option. Option is for instrumental testing also. Now, instrumental testing, you can have dysphonia severity index 2000. Now, this is based on an instrument where you can make a maximum phonation time, highest frequency, intensity, jitter, and a mathematical formula one can able to find out the DSI. And I'm sure that if you are working with the instrument, that instrument gives you the DSI score. Now DSI score ranges from +5 to -5. Whereas +5 means normal voice, -5 means severe persisting dysphonia. Now there we had a score of 100, that is on the perceptual scale. Here it is between -5 to 5. Now this -5 to 5 also has been put into a scale of 1 to 7 for a symmetry purpose. This is done because of the symmetry purpose. So 1 means no dysphonia and 7 means severe persisting dysphonia. Severe persisting dysphonia. And from there, overall voice clarity affected score can be measured just like what we have done for perceptual measure. It is same. So if it is the normal voice, that means score is 5, which is equivalent to 1. So it will be ranging from 0 to 15% of overall voice clarity affected score. If it is severely damaged voice, then -5, then it is 7. Score will be, that is as per the Gazette notification, 7, and that will be corresponding to 90 to 100%. So either overall voice clarity can be obtained either from perceptual test or from the instrumental test, which is available. Again, here also I must say that people can make a little bit of trial to do on some cases and then work it out. Now, for computation of speech disability, for the first time we got a formula, mathematical formula, giving weightage, twice weightage to speech intelligibility affected score. So now the percentage of speech disability becomes 2 into upper range. Upper range, if you remember what I said, upper range, UR is upper range of speech intelligibility affected score plus upper range of overall voice clarity affected score divided by 3. That will give you the speech disability percentage. Let us see an illustration. Speech intelligibility test. The standard scoring is 4, which is equivalent to 5 as per our notification, and standard 4, and the as per the notification guidelines, it will be 5, and corresponding SIA to 5, corresponding SIA, that is speech injury affected score, will become 56 to 75%. 56 lower range, 75 is upper range. Now for voice test, suppose the overall score out of 100 was 35, so it will correspond to score of 3, which will correspond further to overall voice clarity affected score to 31 to 39, and then put it on the formula 2 into 75 plus 39 divided by 3, and that becomes the 63%. So here the person can be given speech disability certificate as benchmark disability is 40%. So that way, first time in probably in the history that we have made a mathematical formula to calculate the speech disability. This was a very wonderful and it's being appreciated all over. Now move on to the language component. That is language disability. That is important here. So we have covered hearing disability, we have covered speech disability, and now move on to language disability, which is very important. Language disability has been mentioned as in the notification as well as in the Rights for Persons with Disability Act as aphasia. The condition is aphasia. Aphasia, again we will say that it has to be a permanent in nature, and therefore it has been very clearly mentioned in the guideline, in the notification, that aphasia testing has to be done post 6 months of the onset. Now that is the time of this spontaneous recovery. So probably we got to wait. So suppose somebody who has got a stroke and has a global aphasia, he cannot be given a disability certificate. So if suppose somebody asks, you can simply say that our notification says that testing for whether to give language disability certificate or not has to be done after the 6 months from the date of onset. So very simple, very clear. For testing the language ability, the test mentioned in the notification is Western Aphasia Battery Test, WAB. And I'm sure many of you will know that Western aphasia battery test is available in many different Indian languages. It is there in Kannada, Telugu, Tamil, Malayalam, Bengali, Hindi, Gujarati, Punjabi, and in case if you don't have, then also there is no worry. You can able to get this adapted in your workout. I was going through that web test is available. It's not very costly, only costing $15 or so. You can even get it online. Standard procedure to be followed. That means the manual of web administration has to be followed. And once again, it has been mentioned very clearly in the Gazette notification that language testing has to be done only and only by speech language pathology. So that is something very important of the Gazette notification of India. In Western aphasia battery, there are two quotient, cortical quotient and aphasia quotient. So we have taken the aphasia quotient as a base for giving the language disability certificate. If you go through with the Western aphasia battery test, tests are done on various parameters like spontaneous speech, comprehension, repetitions, naming, and so naming. In spontaneous speech, the total score in the aphasia battery is 20, and the weightage for calculating the aphasia quotient is also 20. So please make sure, remember this, the red color one. So in spontaneous speech, the total score is 20, and the weightage for calculating the aphasia quotient is also 20. Under comprehension of various parameters, the total score is 200. Total score is 200, but for aphasia quotient, the weightage is given only of 10. So whatever scores comes, you have to divide by 20. In the repetition, the total score is 100, but the weightage taken for aphasia quotient is 10. That means whatever score comes, you have to divide by 10. Naming, again, it is 100. So whatever scores comes for 100, you have to divide by 10. That is, weightage is taken only 10. So the aphasia quotient becomes the total. Total means the total score here 20 plus 10 plus 10 plus 10, that is 50 into 2, that is 100. So aphasia quotient can be calculated in this manner. Let me repeat. For the aphasia quotient, you have to give the test of spontaneous speech, comprehension, repetition, naming. Now this speech test has, or this test has the maximum score. That score has to be converted for aphasia quotient. So spontaneous speech 20, you don't have to convert, take it fully. For comprehension, it is 200 score, converted to aphasia quotient by dividing by 20. For repetition, total score is 100, convert it for aphasia quotient by dividing it to 10. And naming also, whatever score comes, divide by 10, and then total of this into 2 will give you the aphasia quotient. Now web aphasia quotient becomes the base for calculating the percentage of language disability. Now, as you see in the previous slide, the aphasia quotient total maximum is 100, but we made a ready reckoner here. In the ready reckoner, the maximum aphasia quotient number which we have taken is 99 for the purpose of computing the language disability. Now, how do we use this reckoner to get the percentage of language disability? That is very important. Please listen carefully. For example, if aphasia quotient of a person is 56, then the percentage of language disability will be the intersection value of number in tens. So what is in the number of value in tens is 5. And place in unit place, the intersection of value for number in tens place and in unit place. In unit place it is 6. Unit place is 6. So this intersection of these will give us a language disability percentage directly from the ready reckoner. And this ready reckoner has been mentioned or given in the Gazette notification of India dated 5th of January 2018. Now here if you see our aphasia quotient is 5. 56, sorry, official quotient is 56. So when we have in tens place 5 and in unit place 6, the intersection of this is 40. So the person has 40% of language disability. Now, in this case, suppose somebody has the aphasia quotient of 0. So 0 means 100%. That means 100% language disability is there. If score is 99, 9 here and 9 there. Sorry. 9 here and 9 into this. That means he has no language disability or 0 language disability. So this is a ready reckoner, and I must congratulate the team of Dr. Goswami, who has come up with a good idea of getting into a reckoner, ready reckoner, to get into a language disability score. And many of my colleagues in AYJNISD has used this, and probably they have presented a paper in ISHA conference also using this ready reckoner and how valid it is when it comes to web testing. Web is a very standardized test for language testing. So we can able to get the language disability also. This was a very wonderful idea to get into a language disability. Now, this system of ready reckoner for hearing disability, a formula for speech disability, and ready reckoner for language disability, when I first presented in ISHA National Conference, it was very much appreciated and very much accepted that these things logically and works very scientifically in nature. And it is based on our literature. It is not that we have done something on our own. It is based on a solid foundation of scientific study in the area of hearing and speech language disability. The American Speech and Hearing Association representative during the conference, they also appreciated this ready reckoner and the formula based. Association of Otolaryngologists of India has also accepted this method for hearing disability and speech disability and language disability measurement. Many articles have also come using this formula and see that validity is there. State governments have also accepted, and most important, our stakeholders were also happy, especially the deaf group, which has come up saying that there has been a discrimination between the hard of hearing and deaf people, which will be helping them for many benefits from the government of India. So this acceptance has come in a very, very good way from all corners of the society. I'm coming to the end of my presentation, but before I end the presentation, I must go back to Rights of Person with Disability Act and have some more highlights. One of the highlights of this act is that the reservation for job has been increased from 3 to 5%. The reservation in the higher education has also been increased to 5%. There have been many highlights of the act, but one important which I would like to share with you is offences and penalties. If we are giving a certificate, we must little be careful about this chapter also, which is dealing with the offences and penalties. If anyone is found to take the advantage of this act, fraudulently take the advantage of this act, then he is liable for punishment, which can extend to 2 years of imprisonment or 1 lakh rupees fine or both, as given in the section 91. I also must say that the first time there are penalties for atrocities caused on person with disability by any officer dealing with or any office where he is working or anywhere he is living in society as per section 92. So we should be very careful that when we provide the disability certificate measurements, we should be very doing it scientifically with the dignity of the person in mind, that as per the act, the person with disability also has the right of life to dignity and be in the mainstream. So be very careful about this punishment part also. But you don't have to worry about, as there is also a clause, section 97, which is given a protection of action taken in good faith. If you do something which is in good faith, then the Act says that there will be no legal proceeding against that officer who or member of the CCPD who will take this action in good faith. No legal proceeding will be undertaken by that. So don't have to worry about. And I'm sure if you are going to give a disability certificate, please go through the notification carefully and make the test, like especially for the speech test, which the modifications in scoring has been mentioned, which I just mentioned. Take this into consideration so that no difficulty in issue of disability certificate can be there. And one more thing, very important, that all these disability certificates are given on the digital platform. So keep a record. So whatever sample you have, keep the sample. If there is any medical legal, this will be required, that these samples or speech samples or the audiogram which you have been taken, that will be a record for medical legal action. So I think now I have done with these three. And if you have any questions, you can definitely ask me. I will try to say at the end, I will simply say that keep social distance and defeat coronavirus. That is very important. And I'm sure together we will definitely overcome this issue also, and life will be bouncing back to its normalcy. Thank you so much.
It's
Hello.
very good presentation, sir.
Yeah. Thank you so much.
And very good and very clear concept. I think every audience must have. Now it's question hours. Sumanji. Hello.
Hello.
Suman.
So Suman says audio connectivity
If there is any,
lost. Yes, sir.
Okay. Okay. If there is any question or any clarification, yeah.
Yes, I request all the participants to type down their queries in the question section.
Is Suman sir is offline?
Sir is online.
Okay.
Sir, Suman sir, can you take up the questions? Suman sir?
I must say, I must share with you before any question comes. That's Dr. Samir from Kerala. He is also on the medical board. And when he was issuing the first speech disability certificate, see, he got me online and got some clarification done. So that was very heartening. And Kerala government has given the notification that's for issuing of speech disability, and probably he is the first person to issue the speech disability certificate in India. I think so. Anyone, if there is have any information, can share. Aliyavarjung National Institute of Speech and Hearing Disability also issues the hearing disability certificate. And I think the institute must have issued more than 4,000 or 5,000 certificate without a single medical legal case. Is Aish Mysore also issuing a disability certificate, Dr. Amulya?
They actually issue. They don't issue the certificate as it is, but testing, everything will be done. They'll be given a report which they have to take to the MMC, Mysore Medical College, a government hospital, and from there they have to get the certificate done. From Aish, only report saying this much disability is there.
My suggestion will be, like, I wrote to Government of Maharashtra, and Government of Maharashtra constituted medical board within our institute. Even though we are giving the certificate under the head of government of Maharashtra, but we are giving the certificate, they don't have to go anywhere.
Okay.
So probably you can also write to Karnataka government and have a medical board within the institute, because all facilities are there and the
Yes, sir.
medical certificates are now issued online. So there is
Yes,
no
sir.
question of any expenditure as such. So only thing is you have to just feed the data, that is your air conduction threshold for hearing disability, and SIA and OVA for speech disability, and for language disability just AQ. That's all.
Yes, sir.
And certificate will get generated, so that one can go.
Okay. Sure, sir. Sure, sir. I'll
Yeah.
just give this input
Yes.
and hopefully
Right.
it will be done.
Yes, I think that's where we will have our profession, no?
Yes,
Standing
sir. I
solidly
agree.
for the ground. And we have to defend also. Suppose if we give a certificate that audiologist is a signatory there, so he should defend. Or a speech pathologist, he will defend.
Yes, sir. So there are questions.
Yeah.
May I read it
Yeah.
out?
Yes, please.
Okay. So they are asking how to consider the speech, language, or voice disability to give a certificate when they are in therapy process, because there might be improvement seen. So is there any cutoff between the onset of the problem and the period of therapy undertaken?
Yeah, like for example, it's a good question. Like when we say about language disability, if it is aphasia, the testing has to be done 6 months post trauma. So after 6 months, there may be a change. I don't say that it will not be a change, but the change will be there. Certificate at that particular point of time can be issued. So there is nothing like that. We have to still wait for another 6 months. No. And as far as condition like laryngotomy, voice will appear, speech intelligibility will go a little bit higher, but the laryngotomy issue will not be there. So for laryngotomy after operation and the therapy, one can definitely issue the certificate. Let me also tell you one more good point about issuing a disability certificate. The person will be entitled for some concession. Now, speech language disability has not been included for jobs. So don't have to worry about as far as speech language disability is there. Hearing disability, yes. And hearing disability, we know that it will never recover as such. And for speech language disability, the concessions for like a school examination, aids and appliances, I must share with you under the ADIP scheme. The new ADIP scheme is likely to come. When I was the director, I was already there in the meeting. And ADIP scheme, you will also get aids and appliances for speech language disability also free of cost. So that facility can be availed by a person when we are giving the certificate. And the certificate can be reviewed. It is not that certificate cannot be reviewed. It can always be reviewed within 5 years or 3 years or 1 year. You can make a remark also. No issue. Is that clear?
Yes, sir.
Yeah. So one can always. Yeah.
Yes, sir. Yes, sir. You were saying something.
Yeah.
One can always.
Yeah, and I was saying just suppose there is somebody feels that there will be a very drastic improvement or very good improvement is likely to happen, and he is looking for a certificate. Give the certificate. You can always make a little mention about that review after 1 year or 2 year or 3 year, even 5 year. That is that possibility is there, and that provisions have been there. As I said, that they can take the advantage of the disability certificate, especially for equipment and other concessions.
In this scenario, sir, still they will mention provisional diagnosis.
No. See, like for example, when you are going for a speech disability, laryngectomy has been a permanent diagnosis. It cannot be a provisional. Laryngectomy is an operation. It has been done. Now,
I mean for the language.
laryngectomy.
I mean for the language, sir. I mean for the language.
For language of aphasia, suppose if you say aphasia can go normal also. Okay. Now with aphasia, like for example, when we say that from when a person gets an attack, it is almost all the faculties of speech and language gone. So global aphasia. From global aphasia, he can come to anomic aphasia, not nominal aphasia. Now from there you can mention that diagnosis and say review after 1 year. No issue.
Okay.
That you can do. Okay.
I had one question, sir, regarding your
Yes.
AR and SM ratio and your benchmark. These two, how though percentage was 7 point something, but benchmark was 40%. Can you explain these 2 points again, sir?
I think you are mentioning about AQ. Is it AQ? Aphasia
No,
quotient?
in hearing percentage, there is two type of percentage. One, you get it in. Can you go to the slide, sir?
No, I will. You want me to go to in hearing? There is this one ready recognized monaural percentage of disability.
Benchmark disability and disability percentage. These two.
Okay. Yeah. See, in the Act, it has been defined that hearing disabled will be a person with 60 dB PTA in both ears. 60
Yes,
dB PTA in both ears, that is a definition. So what we did is that 60 dB, 60 dB, we have put as a equivalent to 40% of disability. Yeah,
okay,
40% disability, and because it is a benchmark disability. Now, disability certificate is issued as a person with disability who will have the disability of 40% and above. Below 40% and below 40% are not called as a person with disability, and benefits will not be given. So that is the benchmark disability. Okay. Here is very important point to explain that Government of India will give extra facilities to those who have 80% disability. So therefore, we have to express the disability in terms of percentage for benchmark as well as for extra facilities also, and therefore these formulas and these ready recognitions were made. Is it okay, clear, Dr. Chandan?
Can you go to next? Can you go to the next slide, sir?
Next slide. Which one? Formula?
Yeah, this one only, sir.
Formula?
Where this one only. The disability percentage is around 7.23, but benchmark disability is considered as a 40%.
No. You see here, for this case illustration, 1 year is normal hearing, the other one has almost severe hearing loss, right?
Yes, sir.
Now a person who has a hearing loss only in 1 year will not get a disability certificate because his disability percentage is coming below 40. Okay. So below 40 we cannot issue a disability certificate even though he has single sided deafness, but right now we will not. In the earlier act even single sided deafness were given as a disabled certificate, but this deliberately were deleted. Otherwise we will not able to get into a mathematical formula, nor we will able to do the justification for persons who have the hearing loss in both ear and the person who is having a hearing loss in one. So that is the difference. Okay. Here because in the act we have to tell, suppose this person has applied for certificate, we have to tell him in writing that your percentage of disability is only 7.23, which is not matching to benchmark disability, and therefore disability certificate cannot be issued. Okay.
Yes, sir. Thank you, sir.
Yeah. Okay. Thank you so much.
Okay. So the next question. In case
Yeah.
3, do we also include overall severity while taking average? So should we average that overall severity along with the pitch loudness and other things?
Yes, 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 yes. That is. I think you are mentioning about this. This one. You are
Yes,
mentioning
sir.
about this slide. Overall severity,
Yes, sir.
roughness, breathiness, strain. Yes, 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 yes.
Yes.
No issue. No issue. Okay.
Okay. So
Actually,
one more.
there are
Dr. Amulya, in this regard,
Yes.
I had one doubt. How to
Yes.
overcome this reliability or biasness, this perceptual assessment, whether it is a SIR or this CAP?
Hello. No, see, when we say about the auditory perceptual evaluation, that's what I said, that for having the auditory perceptual evaluation, the person needs little bit of, I use the word self-calibration. I use this word because, say like, for example, if you see the voice and roughness, now how do you rate roughness from 0 to 100 scale, that how rough the voice is? If voice is very rough, then you will mark as 100. Otherwise, you will voice roughness is no roughness is there, you will mark it as 0. So this has to come with little bit of experience, which I suggested that at least you do the trial on 4 or 5 cases, and then ask another speech pathologist to rate similarly and see your matching with them. So if you are matching, that means you are doing correctly. If you, in terms of experience, in terms of this, so one can able to learn. That's what I said, that you must do little bit of self-calibration in perceptual assessment of voice as well as intelligibility test also.
Do we need to document
Okay.
this inter-reliability?
No. But you have to document this one. You do it for yourself. Like for example, when we buy a ABR equipment, we do testing on 20 people, 25 people, and have our own standard, reference standard, and
Yes,
then come to the diagnosis. So don't have to worry. But what is important is retain this sheet, that where you have marked and how you have arrived at the overall voice quality affected score, how you have arrived. So this will be a scientific document. It can be placed under medical legal that this is the done and this sample was there, and they can say, okay, let us say this sample goes to another speech pathologist, whether he marks also same or not. That's no problem. Okay.
So how it
Yeah.
was decided to take these perceptual scales only?
Okay.
On what was the
Yes, a very
basis to?
good question. Very good, very good, sir. I think when we were looking forward, our committee looking forward that, like for example, when we want to have a speech disability, now how do we arrive at speech disability? Speech disability, we know that if somebody's speech is not intelligible or has a problem with voice, now that will be the only speech disability. Now for speech intelligibility test, what are the tests which have been there? So we can able to find out these two tests which has been there. Some of the probably the PhD scholars have used this test in their PhD studies also, and therefore we have taken these two tests for speech intelligibility, and for voice. This consensus auditory perceptual evaluation of voice is a very common test and being used in clinically in our institute also, and probably ISHA Mysore also. And the dysphonia index is a standard one, instrumentally used all over world, including our standard this also. What we thought is that if you do only instrumental, many may not have the instrument. So at least go with an option, that perceptual test or this one. And as far as language test, web, we have been very much using it since when we were student. So this is one of the best reliable test, and most importantly, many of the our researchers have converted this test to local language. That is the reason. Absolutely no other way, whether it was developed by AYJNISHD or SRMC or whatever. Is it okay, Amulya?
Yes, sir. Can any
Yeah.
other intelligibility scale be used, or
Right now, no. But suppose you come with the evidence that this intelligibility scale as developed by AYJNIHD is not giving a right one, and this particular scale is giving you the better one, you come with an evidence, then we can definitely write to ministry saying that you can add this test also as an option or delete that test as an option, but there has to be evidence. That's what very importantly I will tell you, that this act is an act of parliament. For any deletion or an amendment, you have to go back to parliament, and remember that parliament takes a hell of time. It's a big time to take this. Now this act was pending for last 12 years, and after 12 years it has seen the day of light. So now government of India has the power to make a decision within the framework, that add or delete the test or add or delete the categories. You don't have to go back to parliament. So this is easy. So if you feel that the other test has giving you a better indicator than this, do a scientific study, come with the evidence and bring it to the knowledge of ministry. I'm definitely sure that the test will be added, because this is a dynamic process. Now tomorrow we come up with a new system, and definitely we will use this. It's a dynamic system. Okay.
yes,
And
yes,
it will be very interesting also. Very interesting. I think, are you working on something like this, or you plan to?
not yet, but now I just got a thought.
Very good. Very good. It will be interesting also. And that's
Yes,
what I mentioned, no, that you can get this, and it will be very interesting.
yes,
But
sir.
I don't think so, sir. We have any another speech intelligibility rating scale which gives you the percentage.
No, 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 no. Right
This
now,
just
no scales give percentage. No scale
This
give.
which
It is
this
we.
which was converted.
Yeah, this is our own thought. Is a very original thought here. This is original. You will not find this in any textbook. Like speech
Yes.
intelligibly affected score will not be found in textbook. Overall voice clarity score will not be found in textbook. But what we have done is, from textbook, we have converted this equivalent to. Like for example, one score is equivalent to 0 to 15%. Okay. So that is, and Dr. Amulya suggestion that if there is any other test which is giving a better indicator, as you said about inter-test reliability, definitely that can be considered. But one has to come with evidence, scientific evidence.
Can it be used this percentage in clinical practice, sir?
Yes, 100%. This is meant for that only. It is 100% meant for that only. And I must also tell you that Act
till
has
now
a,
we use only the scale number and description. We don't mention the
no, you
percentage.
use
But
this percentage. Use this percentage. Why? Because the government of India has given permission to state government that wherever audiologists and speech language pathologists are not available, hire the people in private practice for the purpose of issuing the medical certificate. So you can always do this. No issue.
thank you.
So
Okay.
many are asking whether a disability certificate can be given to children with cochlear implants.
Yes, 100%. 100% it should be given. Why? Because the definition of hearing impairment, as I said, is that it will be 60 dB pure tone average in both ear. And what is the PTA average in both ear for a child with cochlear implant? It is definitely more than 90. So more than 90 will be corresponding to almost 100% disability. Nowhere in the definition it is been mentioned that the PTA is aided. No, it is PTA only. And standard procedure. Standard procedure is using headphone. No instrument to be used while calculating or measuring the PTA. So cochlear implantee children will be definitely getting the hearing disability certificate. No second thought to it, because it is a permanent disability and satisfying the criteria of PTA of 60 dB in both ears. Okay, that's clear,
Yes,
Amulya?
yes, Yes, sir. Yes, sir. I think it's clear for
Yes.
the
Right.
participants as well. One more question,
Yeah, I
sir.
think what? Yeah.
What is
Go
ready
ahead. Go ahead.
reckoner?
Ready reckoner is like, for example, what we have said is this ready reckoner. In hearing disability, when we say this ready reckoner is already there in the Gazette notification. This ready reckoner is already there in the Gazette notification. Now, suppose if you have PTA of say, here in this case, PTA of 77, monaural disability will be 69.07. Now, suppose PTA is 70, sorry, 77 and 77 in both year, then your percentage of disability is 69.07. This is ready reckoner. This ready reckoner. And then for language disability, this becomes the ready reckoner, where you can just know the AQ. Suppose AQ here is 44. So go with this ready reckoner, 4 and 4, that is 53.0. So the language disability is 53.0. This is ready reckoner. Okay.
Yes, so how did you all decide that this is the way it has to be done? It's again all scientific basis.
Great. Yes. Yeah, it's all scientific basis. Like for example, let us say the web ready reckoner. Now, when we say the web rating, web scoring comes from 0 to 100. Now, no language disability is given in the web when the score is 94 onwards. Actually, 93.8 onwards, right? In the ready
Yes.
reckoner, you will see where 0 comes. Where 0 comes. Let us see the where 0 comes in the ready reckoner. 4, if you see the 9 here in the 10 digit and 94 4 in the unit digit, so it comes 0. Can you able to see?
Yes, sir.
Can you able to see this 0 here?
Yes, sir. Yes,
So
sir.
94 is equivalent to 0. That is no language disability. In WAB score, it is 93.8. So only deviation of 0.2. I think this is statistically allowed. This is statistically allowed. Now, this was done keeping the web score. So web score is absolutely same, but it has come in a ready reckoner form. That's what ASHA member, one of the ASHA member has said that actually you are taking the score of web only, but what you did is made a table. But we did not think about this. And I said, we made this table for easy calculation by our people and for our bureaucrats to understand. Otherwise, they will not understand this. Okay. And for hearing also, the ready reckoner is based on the American Medical Association formula for hearing impairment, which is a golden test. It is being used till date, even though it has come in 1960 or so, unchanged. It is being used till today. Only thing is we have made little modification below 60, but above 60 it is as per the formula. Okay.
Okay. Let's say there are many more questions to go. Sanjay sir, should I continue?
Yeah.
I think there is a time limit or any time limit?
I think there is time limit.
That will be allowed by Dr. Amulya.
No, sir. If you want to continue, it can be continued. No issues if the organizers and president are ready to.
I think most of us are free right now, comparatively
Yes,
not
sir.
doing any domestic work. So
Okay. Okay, then I'll go to the next question.
maybe another one or two, couple of questions.
Okay. So many are asking how to. What about in cases like degenerative cases, dementia or Parkinson? Are they eligible
Yes.
for the certificate?
No. For Parkinson's, now Parkinson's will not come under to speech category, but it is already a category. In the 21 category, Parkinson already exists. Okay. And for Parkinson's, there is a different method for calculation of disability certificate. And that is right now it is not with me. but it is Parkinson's is already one of the category, and for that there is a clear guidelines how to give them a benchmark disability of 40% and above. So they will get, but not under speech disability or language disability. Okay, dementia will also not. Yes, neurological condition, chronic neurological condition. Under chronic neurological condition, they can get the certificate.
So it should be given by a neurologist and not by an SLT.
Yes. Not by us, not by us, not by us. And I this off the mark, I'm saying that Dr. Goswami was always telling me, sir, let us go for autism certification also by speech language pathologist. I said, look, let us consider first our own, because it's a new category, and later on we can move, because our field cut across many others. So like if you see cerebral palsy also, speech is one of the parameter, Parkinson's one of the parameter, multiple sclerosis, many others. But that is the other thing. Yeah.
Okay. So what in case of multiple disability?
Yeah, multiple disability is also a separate category. In multiple disability, suppose somebody has more than one disability, right? So he will get, like for example, somebody who has speech disability as well as hearing disability will not get into a multiple disability. Multiple disability is a separate category, and there is a separate rules for issuing of the multiple disability certificate. There are different criteria, not speech and hearing. That's what I always mention. For us, it is hearing disability, it is speech disability, and it is language disability. Now, if you suppose somebody has a speech and hearing problem, what we usually say, the person who cannot hear, cannot speak, he does not fall into speech language category. He falls only in hearing disability certificate, not in the speech language part. Okay, because in language part, we have identified condition as aphasia, and for speech is a langotomy and other.
Okay.
Okay.
Yeah. Okay. So how about cleft palate?
Oh, cleft palate will definitely come. It's there now in the condition. If you see this condition, yes, we have already clearly mentioned in this.
Two or three of them have asked, how about for the cleft palate cases?
Yeah. Maxillofacial anomalies for speech component, we have very clearly mentioned about maxillofacial anomalies. So cleft palate will fall under this.
Yes.
Okay. Yeah. So they will be given speech disability certificate. Definitely.
Okay.
Definitely. Like glossectomy, bilateral vocal cord paralysis. Yeah. Next question. Yes.
Okay. What should be the criteria for the certification of children with ANSD without much hearing loss and ABR absent in both ears?
This is a very difficult question, because for ANSD, our criteria for hearing disability depends only on air conduction threshold. That is something which we have to remember. That is, we have to remember that only of air conduction threshold. And in ANSD, air conduction threshold, if it is less than 60 dB, they cannot be given the certificate. I understand fully, and we have also debated whether ANSD should be brought into this category. The problem with that was, right now we have been basing our criteria on air conduction threshold. The moment we do air conduction threshold and ANSD, the thresholds may be poorer, but the discrimination is much more problematic, and then it will be kind of a difficulty to issue certificate. Hearing is one of the area where most fake certificates are available. You must realize that fake certificate is maximum in hearing only. Those who have normal hearing, they get away with the hearing disability certificate. That's why it is purposefully avoided. If ANSD has hearing threshold of 60 and above, they will be issued certificate. Otherwise, no. Okay.
Yes, sir. So how about child language disorders?
Which one?
Child language disorders. When you say language disorders, only aphasia you spoke about.
Yeah,
How
yeah,
about
yeah.
child
Actually,
language?
if a child language disorder, if it is a like developmental aphasia, then only it will come. Aphasia category has to be developmental aphasia in the children, then it will come. Otherwise, the other language disorders will not qualify for language disability as such now.
Okay, because there are no
Okay.
organic or neurologic component.
Yes. Yeah.
How to go about giving disability certificate based on ABR report only?
Okay. Now this is a very much interesting. Like now it is already given in the notification that for young infant and children, one can base the thresholds on ABR. So if you do ABR or ASSR, it doesn't matter, ABR and ASSR, you have the thresholds, and estimation of threshold can be done with ABR or thresholds can be done with ASSR. Now that threshold can be taken. Suppose if you do the ABR and you get the threshold say around 70 dB. Now this 70 dB threshold will qualify. So the four frequencies you have to punch 70, 70, 70, and then the result will come as per the formula or the ready reckoner. But only one threshold in the ABR can also do. For ASSR, frequency based ASSR threshold can also work it out. No issue in that, because it is already allowed by the government of India as per the Gazette notification. Okay.
Okay. So there's one question asking if someone comes with a disability certificate and the SLP or an audiologist gets to know that there is no problem at all, but still they have been given a disability certificate. How can we take action? So what would be a step when we get to know that they
Oh,
have a fake disability
okay.
certificate?
I think it's very easy. Suppose if you feel that this is a fake certificate, so you can just write to the Commissioner of Disability of the respected state or Chief Commissioner Disability in the Delhi that this person has a fake certificate. Immediate action will be taken by the issuing authority, and he will be sent. Not that his certificate will be taken away right immediately. He will be sent to appellate authority for further testing, and whatever the appellate authority result come. Like for example, there are many who get a job in railway or school service commission, and once they get the appointment letter, they are referred for a second opinion by our institute when I was there in Mumbai, that whether this is genuine or not. And suppose we find that it is not genuine, then we will write to them that it is not genuine, and action is taken. They are not given the job, and the certificate is confiscated. So that is also possible. Just like in reservation cases, if any complaint is there, it will be verified, and if it is found that certificate is wrong, here action will also be taken on the authority who has issued. If motives are there, prove that the person has paid money or something, then penal action is on both the person who has got the certificate and person who has issued the certificate. So penal action will be taken on both of them. Okay.
Okay. So there is
Yeah.
one more question.
Yeah.
Is the facilities available from the government is different for different percentage of disability? Will
I
that
didn't get.
vary?
Say again.
Say if a person has 60% disability and a
Okay.
person having only 40 or 45% disability, will the facilities which they can avail from the government differ?
No. The concessions and the facilities are given for a person, those who have benchmark disability, that is 40% and above. So
And
all
it's the
facility will
same
be
for
given.
any.
Yes, but more facilities are there for person with 80% disability and above. That is, say like for example, if they who have 80% disability and above, you are given a tax benefits also. whereas a person with 40% is also given tax benefit, but 80% is given more tax benefits. Or suppose government wants, say like for example, government is giving kind of aids and appliances. For 80%, you need some kind of aids and appliances which are costlier than what is given to others. So the government will pay you the cost of that also. So facilities will not be withdrawn, but extra facilities are given if the percent of the disability is more than 80%. Okay.
Okay. So do you like to take a few more questions?
No problem.
Okay.
No
So
issue.
the one question is why are we taking 95 dB HL for no response, whereas response can be can you said 100 dB, or why can't we take that? Why only 90 dB
Okay.
HL for no response?
Okay. I think that's also a good question. Here, suppose if you go through with the AMA, the American Medical Association Act, or AAO formula, the benchmark there for the lower fence is 25 dB. That means below 25 dB, hearing is considered as no impairment or no disability can be caused. And 100% disability is caused if the person has a hearing loss of 95 dB. So that is upper fence. Here we are taking 95 as the upper fence and 25 as a lower fence. Therefore, suppose somebody has no response at 4000 hertz. Now upper limit of audiometer, say it may be 120. It may be 120. But here we will only consider 95 because 95 itself gives you 100% disability. Above 95, you cannot have 110, 120 because we are taking average. So if you give 120 there, the average will boost. So even a person who has the air conduction threshold of 40 dB at 500 1K will also get qualified into 60 dB. This 40% business. Therefore, it is very purposefully kept that it will be only 95 because 95 is the upper value that is equivalent to 100% disability. So 110 dB or 120 dB cannot be equivalent to 140 dB percentage. That is the reason. I think it's clear about it, or
Yes, sir. Yes, sir. Yes, sir.
Yeah.
It was very clear.
Yeah. Right.
The next one. What is the validity? For what duration is the certificate issued is valid, sir?
Okay. Like for example, if you see the hearing disability, where it is the profound SN hearing loss, a profound hearing, bilateral profound hearing loss will never revert. So disability certificate can be given as a permanent. Permanent means no need for any. Earlier, the disability certificate was given for 5 years. Every 5 years, you have to go for renewal. That was very problem for a person who is having a severe deafness. So severe deafness will never recover. So why we will waste such kind of thing? So therefore, now a permanent disability certificate is given, which is not to be revived at any point of time. Otherwise, we can also give a disability certificate for 15 years. In case if you feel there is some changes likely to happen for 15 years. Otherwise, permanent disability certificate is lifelong.
So who decides that it should be given?
That medical board. Therefore, in the medical board, very specifically, there is an ENT specialist. Now you will ask one question, that when we are doing the ACT, that is audiologist is doing ACT, and ACT is the basis for disability certificate, then what is the role of ENT specialist there? ENT specialist has a very important role there because he is the one who will certify that this deafness is or hearing loss is permanent in nature. That is not audiologist work. Okay, so that's why ENT is there. Therefore, when we were making this, Dr. Santosh Kakkar, who is a great renowned ENT specialist, he retired as a director at AIMS. He was saying that you are putting onus on us. I said, no, sir, it is onus on both of us. Both of us. So you say it's permanent, we say the degree, and that becomes a teamwork. Okay.
Correct. So all the medical board people in the medical board should sign on it, sir. The
Yes, yes,
SLPD,
yes,
audiologist,
yes, yes, yes,
everybody
yes,
sign
yes,
is a must.
yes, yes. Because they are the member. They are the member, so their signature is must.
Okay.
Their
So
signature is
all
must.
okay. So how about the stuttering and speech sound disorder cases? They don't get
Now tell
referred.
me tell me if the stuttering qualifies in the definition of speech
No, no, because
disability.
it's not a permanent condition,
Yes,
so it
because it is
cannot.
doesn't have organic cause or neurological cause.
So if it's a neurological base of
Stuttering.
stuttering, then they come under
If
the
you can
neurology section because of some other issue they would have got it.
if you can prove in any case that it is a neurological cause, then probably.
Okay.
But
So you're
say neurological stuttering is very rare, very rare, very difficult.
yes, yes. But again, sir, if it's a neurological stuttering, the cause might be of a different thing, and they would come under that neurological condition, and the neurologist
No,
would
suppose
issue the
if
certificate.
they come into that any other neurological condition, they will get into that slot, not here.
Yes. So they are asking where to get this ready reckoner.
You can download from net. You can just say Gazette of India notification 61 dated 5th January 2018. It will come. It's a huge voluminous and for our field you just download page number 91 to 94. Is there in the website.
Okay.
Okay, it's available.
Okay.
Okay.
Just I would like to take opportunity for thanking you all. First of all, I sincerely thank Sinha sir for giving
Thank you
his
so
time
much.
on his retired relaxing life. We disturbed you, sir, I believe.
No,
But
it's a
hearing
pleasure.
hearing this topic from is always like clearing many doubts, as we were getting again and again the questions, and definitely it must have cleared many others. Thank you so much, sir. And my
Thank you.
sincere thanks to ISHA and Dr. Amulya, who has helped us for this conducting this webinar. And I think definitely it's going to be helpful. And lastly, this attendees went to 186. I think I noticed. Definitely, it must have cleared many doubts. Thank you so much, all. Stay at home. Be safe.
Thank you. Thank you.
Thank you. Thank you,
Thank
sir.
you.
Thank you.
Thank you. Thank you, Dr. Amulya. Thank you,
Thank you,
sir.
sir. Thank you. Thank you.
Thank you. Thank you.
Okay.